expressed the thought the meeting may be abandoned until such time as it can be reconvened. Can I remind members and officers that all virtual meetings are being recorded and that recording this meeting will be published on the Cambridgeshire County Council's website. I'll begin by calling the names of all members of the board to establish your presence for the record. Councillor Holditch.
Present.
Councillor Fitzgerald. Councillor Fitzgerald.
Not here yet.
No? Okay, thank you. Councillor Hudson. No. Liz Robin.
Present.
Thank you. Adrian Chapman.
Present, Chair.
Jan Thomas.
Yep, present.
Hi, Jan. Bill Hanley.
Present.
Belle Moore.
Hello, present.
Ray Bisbee. Hi, Ray, I can see you.
Hi, present.
And myself, Councillor Hitford. Okay, moving on, agenda item 1. We've received apologies from Charlotte Black, Gary Howson, Louis Camphor, Louise Mitchell and Wendy Oger-Wellborn. Does anyone wish to, I think I've missed a bit. Is there any other apologies, please? Michelle?
Chairman, Gary Howson is actually present at the meeting.
Oh, smashing. Hi, Gary.
Hi, Ed.
Thank you. Okay, declarations of interest. Does anyone wish to declare any disclosable pecuniary interest or non-statutory disclosable interest? Please raise your blue hand. I'm seeing none at the moment. If you do find you have to declare an interest on the way through, please let me know. Agenda item 2, notes from the meeting on the 27th of November 2020. We're being asked to approve the notes of the meeting on the 27th of November 2020 as a correct record. Can I ask if anyone who does not agree with this proposal to use the raise hand function now? I see no objections to the proposal to approve the notes as a correct record, so we'll take that as carried. Thank you very much. Agenda item 3, the action log. An action log has been included in the published papers for this meeting. All the actions are marked complete except for the first action on page 8. Can the Service Director, Communities and Partnership provide an update, please? Is that you, Adrian?
Thank you very much, Chair. Yes. So the mental health toolkit will be made available. One of the things that we've spent a bit of time doing is making sure that it's got the most up-to-date hyperlinks and the most up-to-date referral routes contained within it. And this has become more important as a result of the announcements over the weekend, where we remain anxious about the mental health and well-being of our population. So we just need to finalise that work, and then this will be circulated. Thank you, Chair.
Thanks, Adrian. Thank you for that. Does any member or officers have any questions on the action log they would like to raise? If so, please raise your hand now.
Sorry.
Okay. Oh yes, Bill. Sorry.
Yeah. Could I just ask on the mental health toolkit? We're talking about early next year now? Are we for that? I expect the delivery of that.
If I might, Chair, no, I think it's virtually ready, Bill. So I'll follow it up straight after this meeting.
Okay, thank you.
Thanks, Adrian. Okay, moving on. Agenda item 4, public questions. We've received no public questions. Agenda item 5. You may have noticed I've rushed through this quite a bit because I think we've got a lot to get through today. So hopefully we can spend a little bit more time on what's coming up. So agenda item 5, government announcements on tiers. Can I invite Liz Robin, Director of Public Health, to update the board on the government's announcements on tiers? Liz, over to you, please.
Okay, thank you. So clearly the major change is that Peterborough has been placed into tier 4, which is known as the stay at home tier. And as such is very similar to lockdown. And the key features of the stay-at-home tier are that people should stay at home unless they need to leave for essential reasons like work, education, going to medical appointments or exercise for health. And as a background to this, the rate of COVID cases in Peterborough, the most recent rate that we have confirmed is 350 cases per 100,000 residents. That's about 700 cases a week. And that is above the national and the regional average. So given that the east of England is generally now above average and seeing rapid rises, that is why Peterborough has been placed into this tier. So I think absolutely key points for the public are about not mixing socially with people who you don't live with or who aren't in your existing support bubble indoors. That's absolutely core, and that is true across a number of tiers. But in Peterborough, the mixing outdoors is also very limited to mixing with one other person from outside your household outdoors in a public place. So that is very different. And of course, these rules persist with no change over the Christmas period, which is, I know, very, very hard for many people and is different from the other tiers, but reflects the seriousness of the situation. And that's one of the reasons why we absolutely want to be communicating the mental health support that's available. I think another thing that comes up a lot is the borders moving between tiers. And basically the guidance on that is that you shouldn't move either into or out of a tier 4 area unless it's for essential reasons, such as you work in a workplace which is in a different area, or that's where your education takes place, or that's where your medical appointment is. So very much the push is to stay local. And try and just be local within your area. I think that's really all I want to say. People will no doubt have seen a lot of this through a number of communications channels. And I know that both Adrian and Christine want to communicate what we are doing in Peterborough across agencies to support the tier 4 regulations, but also all the other interventions and things that we can do together in order to contain the spread of the virus and keep our rates down, turn this round.
Thanks, Liz. Obviously, I'll come to Adrian and Christine in a minute. Does anyone have any specific questions for Liz, please, on tiers that she was talking about? Yes, Val.
And could you give a brief update around the rest of the Cambridgeshire area in terms of the trends, and particularly with regard to Peterborough being a tier 4 now and the other areas are tier 2, and people will be very aware of the hinterland between boundaries as not always being helpful, and there will be a feeling of unfairness, anxiety, mistrust, and equally around that. But in terms of the epidemiology, in terms of the disease around the rest of the area and being tier 2, what's your take on that?
Val, absolutely, Cambridgeshire is in tier 2, and I will be updating on the epidemiology in the next agenda item. I'll be doing a presentation on the epidemiology across the whole area. I do absolutely accept your challenges, but also would say that there's lots of messages that are the same across all the tiers in terms of hands, face, space, staying local, working from home if you can, and trying to avoid any social mixing that's not essential. That's true right across Cambridgeshire and Peterborough.
Okay, thanks, Val, for the question. Liz, it really is difficult for people to comprehend that they're in a tier 2 and then just across the border tier 4, and we're actually, it looks like we're surrounded from the south and the north and the west, etc. I just think it's so important, and maybe this comes with Christine as well, to get this message across of just trying to do everything we can not to go up a tier or 2, as has happened obviously with Peterborough. I don't quite know. Have you got anything else to add apart from what Christine might add later on?
I think I'm very much, we're all absolutely communicating the same messages, and I would just say to and it'll become even more apparent with the epidemiology. But I would say to people in Cambridgeshire that yes, the risks are significant. The numbers are lower at the moment, but the rate of rise in Cambridgeshire is actually higher than the rate of rise in Peterborough in percentage terms. So absolutely, I would be saying to people in Cambridgeshire, don't be complacent. Do everything that you can to stay safe. All those things that we all know keep us safe from transmission of COVID are really important. And I would urge everyone in Cambridge to do that. And a particularly important thing, which is true across the tiers, is not mixing socially indoors with other people, because that's true in tier 2, in tier 3 and tier 4. And we know that one of the easiest ways to transmit COVID is to mix indoors socially with across households. So that's true in all the tiers. I would very strongly urge people to observe that. And clearly, as I've said before, I do have a concern about, and I know this is hard to say and hard to listen to, but I do have a concern about Christmas Day and the Christmas bubbles with households mixing, because that is social mixing. And I would absolutely urge people that the safest way to do this is virtually, online or by phone. It's then safer outdoors with some social distancing, and mixing indoors, as I've said before, does carry a risk, although there's various things you can do to make it safer.
Thank you. John Holditch, if I could maybe just ask you and put you on the spot a little bit. Obviously Peterborough in tier 4 now. I assume the compliance there is pretty good. I haven't heard any difference.
Well, it's been patchy all the way through, to be perfectly honest. And I think it'd be true to say we asked the government about a week before if they'd close the schools down, because a lot of it's come from schools. And as Liz would tell you, it is internal the fact that they're catching it in families, in their own household. So, but we've got wardens on the street, or marshals on the street in the hotspot areas, trying to advise and educate people, and the police are working very well with us. So hopefully with the schools now closed, and that we will see a reduction.
I'm really pleased you said about the police working with you, because I did see that, I think, on the news yesterday as well, that there have been discussions with police, etc. Ray, have you got any comment at all on that, especially with respect to compliance in Peterborough?
Yeah, I would actually like to thank all the councils who have marshals. It is really good, the work that the marshals are doing. They're helping with the first of the 4 E's, which is to engage, explain and encourage people to abide by the regulations. The police don't want to criminalise people, but where people are blatantly breaking the legislation, they will enforce. In fact, I think it's just over a week ago, there was another £10,000 fine given out within the area, and the police will enforce if need be. And as far as crossing borders, the police will be doing certain checks, I'm sure, but there are only certain reasons in kind of tier 4 where you should be going out, and some of those are for work. If you have a medical appointment, you go into the hospital, etc. If you're going out for food, but please don't be breaking the advice and regulations, because all it will do is prolong this. The police are only doing their job if they have to fine you, but please abide by the rules and regulations, and hopefully we'll get through this and it won't be transmitted to the rest of Cambridgeshire to raise those levels. We want to bring all those levels down. So the police are working with all our partners to make sure that the levels come down as far as they can help. So thank you.
Thanks, Ray. And of course, please, the message to everyone, the rules and regulations, whatever tier you're in, obey those rules and regulations. So, yeah, thank you. Val, is that a legacy hand? Yep, okay, smashing, thank you. Okay, moving on, I'd like to invite Adrian Chapman to present the local response and action plan. Adrian, please.
Thank you, Chair. Good afternoon, everyone. So just to set some context here, and Liz will go through, I'm sure, more detail on the epidemiology shortly, but you know, this is specifically about the Peterborough situation, but 2 points I want to make. First, we know, and we heard all weekend about the changing format of the virus, and we want our population in Peterborough, who have been in the main exemplary so far. They've been patient, they've been resilient, they've held it together, they've followed the rules in the main, and we want them to carry on doing that, double down their effort now, and really continue to fight this awful situation. And we know people are tired, people are very fatigued, businesses will be uncertain about their future, but it's important that our communities don't feel that the situation we're in is of their making in its entirety. This is very much about the way the virus is mutating. The second point I'd make is that Peterborough does sit alongside our colleagues in Cambridgeshire, and so all of the work we're doing at the moment to stand up even further enhanced rapid response arrangements are very much geared up to support district colleagues, particularly those district councils that are adjoin Peterborough, so Huntingdonshire and Fenland in particular, who will be very anxious, I think, about how the virus might travel between those borders. To Val's point entirely, actually, that people don't live a life within council borders, they live a life based on their circumstances. So just to reassure the board that we are offering as much support as we can to our district council colleagues, and of course continue to operate as part of a wider system of partners across Cambridgeshire. So with that in mind, I just wanted to briefly update the board on 5 key themes that we are now focusing our rapid response arrangements on with immediate effect. And you'll be familiar with some of the work we've been doing in Peterborough. We think that that is the right approach. We've just taken a further look and refined it even further, and also we're focusing in on areas of geographically and from a population point of view of the most concern. So the first theme is something that Christine, in fact, will update on as soon as I finish, which is around the comms and messaging. You'll have seen over the weekend, probably if you've looked at the guidance, that government are placing a significant emphasis on good, strong communications to deal with the Tier 4 situation. So much of what we need to do is to ensure that our population follow the rules. That's the best and only way to beat the virus until vaccination reaches our whole population. So comms and messaging is significant, but we also need to wrap around that a huge amount of community engagement work. An opportunity to pay tribute again, I think, to our voluntary community and faith sector partners in the city who have been right with us throughout and continue to be with us. I spoke to many of them yesterday, and we're meeting with many of them tomorrow afternoon to ask them to further stand up their efforts and to reach their communities. So that's the first theme, with significant ramped up activity. Secondly, testing and tracing. We have additional testing capacity in the city in the form of mobile testing units and walk-in provision. We're making sure that every single available slot for testing is taken up as far as we possibly can by working with population groups and making sure they can get to test sites, that they understand that it's a simple process, it's pain-free, the results are reassuring in the main. But also we are starting this week some lateral flow testing in quite a targeted way. Lateral flow test kits will arrive in the city on Wednesday, and we will be beginning a process of lateral flow testing across Peterborough with immediate effect, and then that will continue throughout the Christmas New Year period and beyond for as long as is required. And we're also, we've been, as you know, part of a pilot for enhanced contact tracing now for some time. So contact tracing people who the national NHS Test and Trace Service have failed to make contact with after 24 hours, running at about 85–90% success rate as a consequence. And that is very much modelled now across the rest of our county. So brilliant effort on the part of our district council colleagues as well as Peterborough. We want to make sure that we're absolutely on the button with that, and also that we take the opportunity to follow up with contacting people who should be self-isolating to make during their self-isolation period to make sure they're still self-isolating. And if for any reason they've been unable to continue to self-isolate, that we understand the reasons for that and put in place measures that can support them. Thirdly, we know that not enough people nationally are self-isolating when they are required to do so for various reasons. So that's people that have had a positive test result, but also all of those people that have had been traced by the either national or local scheme aren't necessarily adhering to the self-isolation rules, now required to self-isolate for 10 days if you've been contact traced. So government have made that slightly easier. They've reduced it from 14 days to 10 days, but we want to make sure locally, and this goes for Cambridgeshire, I have to say, as well as Peterborough, we remove any and all barriers to people self-isolating. We already have our own local discretionary financial scheme, which provides up to £500 for people who find themselves financially in hardship. But we'll look again at that figure and make sure that it's fit for purpose, and also look at other forms of support and advice that prevent people from, as I say, being able to self-isolate for the entire period. And we kind of recognise it's going to be really difficult over the next couple of weeks, at a time when people want to be more relaxed. They want to get out and meet people over the festive period, but it's more critical than ever given the virulent strain of the virus we're now seeing that people do self-isolate. Fourthly, sorry, Chair, I'm nearly there. There's a whole thing, thank you, around compliance, and we want to make sure that both businesses are aware of the need to follow the rules, very much a comment that Councillor Holditch was making, but also that they are supported with advice and guidance, and those businesses that are continuing to deliberately flout the guidance, appropriate action is taken. But also in our high streets across the city, not just the city centre, but those neighbourhood centres where there are large numbers of essential retailers that can continue to open, fast food outlets and restaurants that can convert to takeaway provision. We want to make sure that our residents are kept safe whilst they're accessing that kind of support. So Councillor Holditch mentioned our team of 30 marshals. We're saying to our marshal team that they can have Christmas Day off, but that is it. The rest of the time they'll be on duty. And that probably seems a little bit over the top, but we're anxious to make sure that our communities on all of the holidays, as well as those working days in between Christmas and New Year, are kept as safe as possible. As the Commissioner said, the role of the marshals is largely at the engagement end of the spectrum, the 4E spectrum. So they are there not to police, but I'm really pleased to say our policing partners have very much reconfirmed their support for our efforts and have again been with us throughout this whole process, but more recently alongside us in several workshops and focused discussions to make sure we get the offer right. And I know they'll be out on patrol with us as and when required. And then finally, and of particular interest, I think, to our district council colleagues, as well as to councils outside of the Peterborough area to the north, will be the way that people travel to work. So as Liz mentioned, people in Tier 4 are able to leave the area to travel to work if they are not able to work from home, though every effort must be taken for them to carry on working at home and find alternative ways. If they do have to leave the area, we're anxious to make sure that that's done as safely as possible, and we'll be working with employers as well as with our district council colleagues and others to provide the right support, advice and guidance to keep workers that travel outside of Peterborough and back into Peterborough safe, but also to protect the populations in those adjoining areas. That's a critical piece of work, and our workplace cell, which is led by one of Liz's deputies, met yesterday to begin the development of a detailed plan in that regard. Just want to mention, aside from all of that work, that the Tier 4 status for Peterborough means that the clinically extremely vulnerable cohort of residents becomes at the centre again of some of our work. So at this stage, government have not announced that shielding in its fullest form will be reinstated. We don't expect that to be the case, but we do know that people with clinically extremely vulnerable characteristics need to particularly take care. And we're contacting all of the 6,000 or 7,000 of those people that live in Peterborough today and tomorrow to make sure that they are aware of the rules and the guidance and are kept as safe as possible. And of course, our hub network will continue to operate throughout the festive period should anybody need any direct support. And then finally, from me, I just wanted to acknowledge that we recognise this is a difficult situation for so many people, residents, business owners, employees, partners are all struggling with fatigue, and we are anxious about people's mental health and well-being. And we'll be making sure that there is information widely available to support people who are finding this a step too far, to make sure that they can reach the advice, support and help that they might need, both over the festive period and for as long as the Tier 4 status Peterborough lasts. And again, of course, that's replicable as well for Cambridgeshire, in whatever tier we find ourselves in Cambridgeshire. So I hope that's helpful, and of course happy to take any questions.
Thanks, Adrian. I've got a question. I'll bring John in before, but just before that, is our volunteer base as strong as ever?
Yes, Chair, it is. We maintain contact with our volunteers. Many went back to work at the end of the first phase, but I would say we've still got about 1,500 registered volunteers. On top of that, I think one of the great strengths of what we've been through over the last 9 months is the strength of the relationship now between ourselves and the wider voluntary sector, and also our parish and town councils, who just continue to blow me away. I stand in awe of what they do, often in their own time. They're not paid. I'm paid to do what I do, they're not, and they do some amazing work, and they are supporting us right now with transport to get people to vaccination sites. They've been carrying on providing food and wellbeing support, and that I know will continue. So we're in a good position.
Sure. Much thanks to them all. Thank you for that. I'll bring John in just before I have my question. John?
Yeah, I'll start with a positive note. There's only 371 sleeps until Christmas, if you work that out. Adrian, this testing that's coming this week, I forget what you called it. What's it mean? What's it do?
So it's called lateral flow testing. Perhaps Liz, Harkins itching to comment on this, probably is actually our expert. And rather than me fudge it, I'll ask Liz to give you
the public won't know what it means, so no. we ought to tell them.
Can I have a brief description, Liz, please?
Brief, yeah. So it's another form of testing. It's not PCR testing, which is what has happened so far at the local testing site in MTU. It's a different form of test that looks a bit more like a pregnancy test and takes about half an hour. So it's done through a nose and throat swab, like the other sort of testing. It's not as accurate as the PCR tests that are used on for people with symptoms, but it can be used to test people who don't have symptoms, and somewhere between about 50 to 80% of cases, people who are positive for the virus will be picked up. So it doesn't pick up everyone, it's important to say that, but it will help us to identify a lot more cases amongst people who wouldn't otherwise have had a test. And it's the mass testing that they used in Liverpool. If you do get a positive test, you then need to go on and have a PCR test to confirm it. But it's very useful to just sort of pick up more cases where you know that you've got a cluster of people who may have been infected but don't have symptoms. And that's what we'll be using it for, to test those higher risk populations.
And I think we're going to move it round Peterborough, are we not?
We are. We're going to respond to the epidemiology as we always have, and we're going to move the testing to where we think that there's higher risks, and therefore we want to test people without symptoms.
And I've never known a pregnancy test to be taken from swabs in your mouth.
John, we haven't got time for this. We know how much you like to go down other tangents. We haven't got time for that today. Thank you. Bill, I see you found your blue hand. I'm very appreciative, but if I can just come in first. Adrian, I don't know when we're going to meet again as a board. So what's the latest on education and the testing for schools in the new year? Or maybe you're not the right person to answer this. I don't know.
Again, I might, through you, Chair, ask Liz to step in on this.
Oh, okay.
She's our lead for that area of the business. Sorry, Chair, if that's okay.
That's fine. Liz, please.
Yes, well, clearly the guidance has gone out to schools about the phased return and using these lateral flow tests in the schools to test the pupils and staff. I think it's fair to say that at the moment we are just waiting for more detail on that guidance to understand exactly how we will be operationalising it locally, because I think it's quite a challenge, and people who have just finished term the teachers and so on need a little bit of a rest. And then we'll all be getting together to look at the guidance and how this can be operationalised.
Yeah, I think everyone, I mean, it's very easy to bring out guidance. It's the implementation. So, okay, thank you. Bill.
Very brief, thank you, Chair. Just make the comment, the lateral flow test doesn't mean anything to people at all. I just wonder whether or not we can think of a better name for it that rolls off the tongue a bit better.
That's the point I was making.
Okay, I'll leave that with you, Liz, and others. Okay, I've got no one else that wishes to come in on this, so I'll move on. Could I now ask Christine Birchall, Head of Communications and Information, to present the communications strategy? Hi, Christine, welcome.
Hello, good afternoon. Thank you. And just to reassure you, when we're talking to the public about the lateral flow tests, what we call them are the rapid response tests. So they're the tests that you can get a response in 30 minutes. So we haven't gone out to the public at all and called it lateral flow testing, just to reassure members of that. So I was going to, as I normally do, give you an update of all the work that we've been doing and the toolkits that have been going out as a regular set of communications materials that have been going out every week through December, all the updates using all of the different avenues that we have and using all of the partners across the whole of the Warn and Inform public sector communications cell. But obviously, like you, we had the update on Saturday about the move into Tier 4. And so an awful lot of work went on yesterday to revise messages, to look at the information that we'd already got up across all of our systems, the information that had been planned to go out this week, and all to make sure that we had nothing that would confuse or conflict with the governmental messages. There isn't very much national material about Tier 4. There's one poster. There's not anything else at the moment. So we're busily making our own information so that we can put things out in a really easy to understand way. But what we worked on yesterday and spoke to members of the strategic coordinating group was simplifying what we were going to say into 5 key areas. And we've put out information across, again, the whole system this morning with how this can be done and talking about different advocates to take up different parts of these messages. So the 5 messages, and they very much wrap around what Adrian has just been talking to you about, is firstly to acknowledge that this new variant is much easier to catch. And that helps explain the increases. It's not entirely, we can't put it entirely down to it altogether, but this is very much helping to explain the very rapid rise in the southeast and the east of the county. So what we don't want is people to say, you know, I've been doing this for so long, it's making no difference, why should I carry on? So it's very important that people understand that this variant is up to 75% more transmissible and more catchy than any other variant of this disease. So we want to make sure that people understand that we have got that in Peterborough, and we believe we also have some of it in Cambridgeshire as well. So it's really important that people know that. And then following on for that, that all of the new Tier 4 regulations and the change to mixing across the whole of the country are designed to do just one thing, and that is to reduce absolutely your contact with anybody you don't live with. So if there is one thing that we could all take out and promote, and it's very, very easy for people to understand, it's to look at all the things you do and think, how can I reduce my mixing with anybody I don't live with? And if I do have to go out, if I do have to mix with other people, how can I do this in the safest possible way? The leaving space, the wearing the masks, the hand washing, the staying in the very well ventilated places, avoiding crowds, all of that is part of that very simple message about avoid getting with anybody that you don't live with, because this variant is very much more transmissible. And while we're doing that, we want to make sure that people understand, you know, we're asking them to do something which is, you know, more difficult. We've been asking them to do it for 10 months now. We want to make sure that people know about the support that's out there. So particularly the business support, because overnight, a lot of Peterborough businesses were asked to close. So we want to make absolutely sure that there is no impediment. So the businesses that were closed during November will automatically be getting information from Peterborough City Council today and tomorrow to check their eligibility and get money out to them. Again, they don't have to wait or worry about that. But we do know that up to 50% of those who were eligible last time didn't apply. So we're doing quite a lot more work to make sure that people understand what the government grant is available, how the government grant can be applied for, who is eligible, and also to make sure that people know that if they are not eligible, there are discretionary grants that Peterborough City Council and all our district and other city colleagues have got available. So businesses should make contact, and we are upping our communications around that. And also people's individual finances, so continuing to promote things like the winter grant that has been rolled out across Cambridgeshire and Peterborough, particularly initially to make sure that no child who receives a free school meal is left without food at lunchtime throughout the holidays, but also that families who are in a vulnerable situation have access to food, to heating, to essential white goods support. So we're rolling that out as well, and also all of the support that's available through the hub. So we're making sure that people are aware, if we're asking them to stay at home, to keep away from other people, to work from home, or to do other things, that there is support available to them. And that brings me on to the fourth point, which is about mental health. So this came as a shock to a lot of people. A lot of people have been hanging on desperately, thinking I'm going to at least be able to see people at Christmas. And so for people who are on the edge and thinking I just can't stand it, we need to make sure that they not only know that there is mental health support available through the Lifeline service, through the 111 service, but also that there are befriending options from all of the hubs, from the county-wide hub and also all the district hubs, and also encouraging people just to phone their neighbours or to wave to people that they see in the streets, you know, to make sure that people realise they're not alone in Cambridge and Peterborough. There's a lot of support out there for people who were hanging on and hoping that they could see people. And then the final point is about making sure that people understand there is hope. We do have a vaccine. It is being rolled out really well, and we're going to come on to that later on in the agenda. And we would encourage people who get the call to absolutely take up the option to be vaccinated. It's safe, it's effective. We want as many people as possible to take it up. And that is our hope. But until that is rolled out to everybody, and that is going to be spring, we need to make sure that people are following these very simple rules and not thinking of ways to get around the rules, but thinking about ways that they can take them forward. We've got suggested key advocates for all of those areas. We sent out information to the whole system with ways that people can pick this up. We've asked everybody to ask their key leads to pick up these messages, to get them out. We will be producing materials to help them do that, and these will be going out from today and tomorrow. So that's what we're doing at the moment, and I'm very happy to take any questions on that.
Thanks, Christine. That's very good. Thank you. Just one thing, if I can pick it up, right at the beginning, you were, not to you though necessarily, right at the beginning you were saying that the information came out over the weekends and all the work that's been done. Maybe I could ask Gillian Beasley, the Chief Exec for both Cambridgeshire and Peterborough authorities, you know, just how much work is going on behind the scenes here that maybe many don't know about.
Oh, thank you. Thank you, Chairman. Yes, we all heard the announcement, I think, from the Prime Minister, and immediately there was communication between all of the major organisations involved in response, the CCG, the police, fire, voluntary sector and other district councils. We stood up meetings that evening to look at the announcement and determine what might be needed. We started to plan that evening as well, and we attended government meetings to actually understand this better. The following day, we probably worked the whole day. We started off by doing just the local action planning, then we met with a wider group, and then we continued that planning, including all the communications that Christine has just described. So actually what you saw was the immediate response, the immediate action planning, and then that translating into what you've seen at your board today. And we do that whatever the changes might be. So if there are further changes, we'll be in a position to step up as effectively as that, Chairman. Thank you.
No, thank you. And I know this is a member-led engagement board, but I'm sure on behalf of all members, we thank everyone involved. So thank you for that.
Okay.
Any questions at all for Christine? No, okay, thank you, Christine, for that. Okay, so we've got 20 minutes left, which is about 10 minutes, I hope, on each of what we've got left. First of all, we've got an update on local epidemiology. Can I invite Liz Robin again to report on this? Liz.
Okay, I'm going to try to share my screen. If I can't share the slides, then I'll ask Michelle to do it. Okay.
Yeah, we can see it. Yeah.
Lovely. That's good. I'll just try and get it onto slideshow. Okay. So this is for both Cambridgeshire and Peterborough. So to start with, this just shows where we are against the national position. You can see Peterborough here, Cambridgeshire here, and basically the darker the colour, the higher the rate of cases of COVID. So you can see the east of England with particularly high concentrations down towards London, over here to the west, and up in Peterborough and Lincolnshire. Then the next thing that I'd really like to emphasise is that the rates of spread of COVID and the rates of COVID cases per 100,000 population are increasing sharply in all areas. So you can see Peterborough starting from a higher base on this purple line. So it starts from 200 cases per 100,000, goes up steeply to 350. But you can also see South Cambridgeshire starting from under 50 cases and going up to over 150 very quickly. And you can see all those areas rising in the recent period. So Peterborough's rate, as I've said, is higher than England and has had about a 50% increase in rates in the last week. And that just takes you through Peterborough. And then if we go down to Cambridgeshire, you can see here a slightly different pattern with a dip down during lockdown to lower rates, and then a sharp increase more recently in case rates. And just taking you over to the table, which gives you a bit more detail. This gives us the most recent case rates up to the 15th of December. For Peterborough, that's about 350, so that's above regional and England averages. For Cambridgeshire, it doesn't actually show it specifically on the table, but it's about 150 cases per 100,000. Cambridge City, 150. South Cambridgeshire up to 172. And Fenland is the highest district in Cambridgeshire at about 180. But what you can see here is that in all areas, those trends are rising. And what I'd like to call your attention to is actually the rate of rise in areas of Cambridgeshire. And that's the percentage increase from 1 week to the next. So it's the percentage increase from the week ending the 8th of December to the week ending the 15th of December. For England, that rate of rise is about 57%. In the east of England, which with London and the southeast is quite central to this epidemic at the moment, the rate of rise is 93%. In a week, so that's nearly doubling the number of cases in a week. If you then look at where we are locally, Peterborough's a bit actually below the national average on rate of rise. It's about 50% in a week. But if you go to South Cambridgeshire and Huntingdonshire, which are starting from a lower base, but they are increasing very quickly, doubling in less than a week and at a higher rate than the east of England. So that's of concern. Cambridge and Cambridgeshire are similar to the regional average, doubling at about 90% a week. And Fenland and East Cambridgeshire, their rate of increase is a bit lower. But that is of concern because the rate of rise is something that we've seen in other parts of the southeast London, South Essex, that you get this very sudden and quick rate of rise and that continues. Our figures are up to the 15th of December, but we have some sort of not fully validated figures after that, and those are showing the rise continuing. It isn't just a blip, it's continuing up. So that is of real concern and is probably the main point I want to get across. And this shows the number of cases people admitted to our local hospital trusts. The top line is the total. Again, you can see that is going up sharply. Jan might want to comment more on that. It's highest in the Northwest Anglia at the moment, with those high rates in Peterborough and Fenland, but also has increased there. Our deaths are going up since the summer in both Cambridgeshire and Peterborough, and our deaths will really reflect what was going on in the November-December lockdown, because they sadly happen normally about 4 weeks after the cases rise. So you can see Cambridgeshire up and down a little, but definitely has had some more deaths than in the summer. And in Peterborough, the deaths have increased more. So sadly, we are seeing deaths again from COVID. I'll finish there, and hopefully, yeah.
Great, thanks for that, Liz. Wayne, want to come in?
Well, just for the benefit of everybody else, hello, Liz. I'm sure I'll catch up with you. You're now refreshed. How much truth is there in the media statements about this being the new strain, being attributable to the faster rises or increases, perhaps, that you're illustrating in the tables? Does that have any bearing on it, or is that just media speculation? And also, do you have any other evidence of what's driving it in particular areas or in particular communities?
Well, I think there's always the difference between looking at what's likely and looking at what is absolutely scientifically proven, Wayne. And of course, in public health, we look at all of that. So we do know that we have a new strain which is more transmissible than the previous strains, between 50 and 75% more transmissible and easy to catch. And we know that that strain is becoming the predominant strain around the east of England and basically the tier 4 areas. It is, it's likely that it is contributing. Having said that, in terms of the science, everyone is working hard on the properties and the sort of reporting on this new strain. So we're sort of digging down under that nationally to really understand exactly how this is playing out with the new strain. And I'll be going to a meeting on that later this afternoon. But at the moment,
I suppose what I'm trying to tease out, Liz, is it the new strain that is the culprit in causing the infection rates to jump significantly, as your tables are showing, or is it because people aren't doing what they should be doing, if you see what I mean? Which means we need to do more. That's where I'm trying to get to in my head. That is it there, a fault of a failure in obeying the rules, hands, face, space, etc., or is it something that has got beyond our control, in the sense of the media are speculating that our rises in the east and the southeast are down to the new strain? And I don't know whether that's true.
I think there's two things, Wayne. One is that the November lockdown ended, and the other is that this new strain is becoming more prevalent. And in my personal view, and I am not a national scientist, but my personal view is that those two are probably both contributing, because clearly the rules have become more relaxed after the end of the November lockdown, and we've got this new strain which is more transmissible. I think the key message I'd like to give is that even though this new strain is more transmissible, and I think it's likely that it is contributing to the rise, that the measures that we need to take to stop the new strain spreading will be the same, because it's a respiratory virus. It will spread through people being in contact with each other and people mixing. So we just need to be, I think it is likely to be contributing to the increase, but we need to absolutely be even more rigorous in the things that the public health measures that we know work, which is people not mixing, people distancing, really good hygiene, and also those face coverings. So the public does need to be more vigilant in taking those measures, because the accumulating evidence is that the risk of transmission is higher.
Okay.
And I think that's an important message, because it's not saying to people you've failed. because I think Peterborough communities have worked really hard, but it's saying we need to be even more rigorous in what we do.
Sorry, Roger. Well, the evidence would suggest that we're doing something better, even if the new strain is in Peterborough or this variant, because if you look at the figures you quoted, we are below what is the average, and in terms of the significant rises week in, week out, or week on week, we are a lot less than, say, the South Cambridgeshire and the Huntingdonshire figures. Okay, it's just food for thought, that's all.
No, thank you, Wayne. Listen, John Holditch, you've got the Go Faster sign up, and I'm doing my best here, honest. So I don't know if you did that on purpose or accidentally, but maybe you could just undo that in case you want to put your hand up as well. So Gary, don't worry. Gary, if you could be quick, please, because I want to get Jan in as much as possible.
Yeah, I will be quick, Chair, but I just want to reiterate what Liz has said, and to answer Councillor Fitzgerald's question. I think the communities have been doing a fantastic job in Peterborough. The percentage rise, of course, is going to be affected by what the baseline was. So I think it's really important not to get stuck into the statistics. The really important thing are those messages, and I know we're in a hurry, but I am going to repeat them because that's what's going to make the difference here. It's about washing your hands for 20 seconds with soap and water very regularly. Certainly if you leave the house, when you come back into the house, or you've been touching anything that's come into the house, it's about covering your face when you're required to do so, unless you're exempt. And it's about leaving 2 meters between people, especially when it's others who aren't in your household. We can't stress enough the danger that's inherent in mixing with other households indoors. That's where we're seeing the rises occurring, and that's really, really important. I do just want to say something from an NHS point of view. I'd applaud the system working and the cross-agency working, but from an NHS point of view, I think it's really important to say that whatever tier people are in, the NHS is still here for them. It's really important if people have an appointment for a COVID vaccination, you might be in tier 4, but you are still able to go for those. So if you have an appointment and you've said you'll go, please turn up, because it's important we use the vaccine in the time that people are allotted to it, because it doesn't have a long shelf life. It's really important if people think they're going to need to leave the house for healthcare, but they're not sure where to go, and they've got an urgent need, to call 111 first, because they will not only be able to signpost people to the correct place, but they'll often be able to give them a booked time, so they won't be hanging around in waiting rooms that could potentially be crowded and expose them to increased risk. And the last thing is, we're all very sad that Christmas isn't going to be what it is, and the virus may have got Christmas from it, but we mustn't let it take the NHS from us. So that message about protecting families and friends and protecting the NHS is as true now as it was 10 months ago. The NHS teams are under phenomenal pressure with the usual winter pressures and the increases in admissions we've seen already. So follow the rules. It's so important that people do that. I'm sorry that's taken a couple of minutes, but I think that's the most important contribution I can make to this meeting, is just to stress those simple rules. Make a huge difference if people sticks to it. Thank you. Yeah.
Thanks, Gary. Thank you for that. Okay, I'm going to move on, and can I invite Jan Thomas, Chief Executive of the CCG, to update us on the vaccination programme. Jan, hi, welcome.
Hello there. Yes, so the vaccination programme is obviously now live. We are vaccinating using the Pfizer vaccine, which I'm sure you're all aware of. The vaccine itself comes in specific batches, and our role that we are taking is to make sure we can use every single vial that comes in those batches and give it to as many of our vulnerable groups as possible, specifically starting with the over 80s. We are currently doing that from 4 places, and that is the 2 hospital sites, one at Addenbrooke's in Cambridge and one at Peterborough. And we also have the first 2 sites live from GP groups running out of Ely North and Ely South, which is in Statlow Medical Centre and Soham. So they, Cathedral. Sorry, so those 4 areas are successfully managing to deliver every single dose of vaccine that they are provided with. Obviously, though, our mission is to try and get absolutely everybody vaccinated. So we have very strong plans in place for further GP surgeries to come on board over the coming weeks, and also sites in a couple of city centres to make sure that we can run the vaccinations there as well. There are a number of variables at play at the moment. It is firstly the availability of the vaccine, then making sure the sites have the right storage facilities for those vaccines. And obviously there is a lot of time going into making sure we're training staff about how to draw up and administer this vaccine safely. I can assure everybody on the board that every vaccine that we have has been treated like incredibly valuable cargo, and the amount of vaccine that hasn't been able to be administered is absolutely tiny, and is due to a couple of small instances around drawing up of doses, for example, and nothing to do with people not getting the vaccine because people aren't coming to a clinic. So people are turning up, they are following the rules, and we are seeing a very successful rollout of our programme for Cambridgeshire and Peterborough. We do have a little bit of a logistical problem in that we are just working out if we can stand up even more telephone booking services, especially when we roll out across all the PCNs. I know that some people have had difficulty getting through on the telephone lines, and I am sorry about that, but we are looking to expand that telephone infrastructure to make sure that we don't have the same issue. That isn't stopping us using every single slot and every single drop of vaccine that we can have. It is that demand is outstripping supply right now. Obviously, this is all based at the moment off the Pfizer vaccine, which is the only vaccine that we can use. We are making plans if other vaccines do come on board, and that will make things like the storage and the administration easier, but we are using what we've got right now. And I should just say the decision about what site comes on board when, I know I get, I've had lots of suggestions from lots of people over potential sites and questioning geographies of where we can put them. That decision is made centrally, and then we are told which sites are, we suggest sites, and then we're told which ones come online and when they come online, and then obviously the equipment flows after that. So we think, we are hopeful that we can get some additional capacity up in areas like the Wisbeach next, and that's been our proposal, and we're just waiting to see if we can get go, no-go decisions on that. I shall pause there, Chair.
Thanks, Jan. I also heard, and I don't know if you can confirm, but on the news this morning it said whatever else is happening at borders on the continent, the vaccines won't be held up. So I thought that was good news.
Yeah, we haven't been told that there's any disruption to the supply of vaccine from the numbers that we knew we had in the first place.
Okay, I've got 3 people that wish to come in, and I'm just going to ask, can you please be as brief as possible? So I've got Bill, then Peter, then Gary. Bill.
Thank you. I'm going to ask the question that I asked last week.
Yeah, you asked me on Friday.
On K. Yeah, on
K. The answer, Bill.
Still haven't. No, I just want to make the point that, you know, we might be in a situation in the villages where elderly people are vaccinated and their carers are not, and that just seems wrong to me. So I'd really like an answer on that, if you wouldn't mind. Thank you.
Yeah,
right.
I have got it, Bill. I'm sorry, I will come back to you.
All right, Bill. Thank you. Peter.
Thank you, Chair. Jan, a good bit of news, really. We've been getting fantastic feedback from people in East Cambridge for their vaccinations, particularly in Soham. That came through to me last week. So that's brilliant. Thank you. What I would like to urge, and I know you can't at the moment, but I really want you, please, if you possibly can, to urge. I come from South Cambs, the northern bit of South Cambs, and there's lots of people in the villages around where I live, Longstanton, Over, Oakington, Willingham, who find it very difficult to get to Addenbrooks. So as soon as you can get it out to the GPs, and as soon as we can roll this out, the better. So if I could ask you to really think about that, that would be great. Thank you.
Yeah, thank you for that. As I said, we have developed and got sign up from our PCNs across the patch. We are developing plans with them. As I said, the decision of who goes when doesn't sit with us. So we are preparing all options to see what we can do, and then so that each one of those sites, as we're allowed to go live with them, we can. But that decision is being made elsewhere, but we are making sure that they're all ready. But I do know how difficult it is. And we're also looking to see what the opportunities are for other places, for example, like Hinchinbrook Hospital. So we are trying to make sure we get full coverage.
Thanks, Jan. And lastly, Gary.
Okay, thank you, Chair. It's just really to touch on those last 2 points. The prioritisation and the order in which the vaccines will be given has been determined nationally by the Joint Committee of Vaccination and Immunisation. So that's not a local decision. So we'll be going down the list as determined nationally. With regards to bringing general practices on board, general practices are all ready to go. It's purely the logistics of this at the moment that's making it near on impossible. Once, and we hope it will be very soon, we get the AstraZeneca vaccine has been through the authorization processes, the storage rules around that are much more like the flu vaccines that we do. And we know that general practice has the expertise and the efficiencies to be able to do that rapidly. So hopefully when that comes on, that will answer the last 2 questions that was there. It was just to remind people that once they've been vaccinated, they need both doses before they are protected against getting seriously ill. And we don't know how effective it is against transmission yet. So those rules we were talking about earlier are still as important as they were at the time. And I think I just want to put on record as the chair of the commissioning group that this is the biggest challenge for collaboration I think that health, local authority and voluntary sector have had to date. And the way that everybody stepped up to the mark to make sure we are rolling this out as far as is physically possible within the realms of the supply of vaccine we have at the moment is testament to a phenomenal amount of work that's been going on in the background, day and night, weekends, weekdays. And so a big thank you from me to all the teams. That's my team, the local authority teams, the voluntary sector, and especially to general practices who are trying to balance stepping up to do the vaccinations against all their other pressures at the moment. It's been an amazing effort, and I think we should celebrate that. Whilst we need to be mindful of the challenges ahead, let's celebrate the fantastic work that everybody's doing at the moment. Thank you, Chair.
Thanks, Gary. I'm sure we're all in agreement. We're slightly over our time. We have got one last agenda item of any other business. We haven't got time to discuss anything. So if anyone does have any other business, could I ask them to either email myself or John Holditch or Michelle? And on that note, a big thank you to everyone. I know we're all very busy, but I think it's been really good and informative meeting. So thank you very much.